Hello, I'm Professor Emeritus Jody Irving. I've been on the faculty since the late 1960s, actually 1965, up through 2011 with a stop out early in the early years for graduate school. I now teach part-time in the doctoral program in psych mental health nursing, which is basically my background of content, teaching-wise, sometimes a little public health. Also had a private practice that lasted close to 40 years. I did individual as well as family therapy. So I just wanted to make a few brief comments a little bit before I get into the particulars about the College of Nursing history. Obviously, history is always very relevant. It's important to take a look at where we've come from, what's happened in the past, and it has, a little bit of a dictate for the future, not completely, but it is important to get a sense of your place in history, and all of you now are in a particular beginning place in your own history in the College of Nursing. Nursing history is really fraught with a lot of parallels to women in their history in society. So we've had kind of a struggle of moving ourselves out of that position in terms of its influence on nursing. Fortunately, with the increase of men in nursing as well as minorities, we're getting a little bit better diverse, and it's really expanded, I think, our abilities as professionals. I think you're going to learn in this course and as you progress through the curriculum that nursing is both an art and a science. You can't really, in my view, have one without the other. I think if you do, you'll be a failure to your patient and patient care. Technology is very seductive. So having that piece of the art of nursing, the humanity, has got to be a parallel part of using the technology and all the procedures, etc. You can't really have one without the other. I think that you'll get a better sense of this as you move into your clinical settings pretty soon. So nursing education itself has had a lot of struggles to come out really from the diploma or hospital school mentality. These were the early days where students went and became nurses through working in the hospital. They took a few courses, sometimes taught by physicians and so forth. However, it was a lot of exploitation actually, and a lot of hard work for those early nurses. We've now moved nursing into higher education, where we have the opportunity to really do a lot of different approaches to the learning styles and the use of students, if you will, per se. I think that that apprenticeship model that we've come from, it still lingers a little bit in the overall view of professional nursing, but we've really moved away from it considerably and are becoming much more identified as a professional level of practitioners. Probably there's no one that elevated some of these ideas more than Dean Dorothy Smith, the founding dean. She was a formidable individual, a clear thinker, and really had a vision about how to move nursing education into academia and to support it with academic values. It was a really different time in the middle 50s, I should say, when the college started, and people really, there was a lot of controversy really about the curriculum and how things got started here at the College of Nursing. She really promoted things like nursing history, students taking nursing histories from their patients, and using communication skills, and the assumption that our students would be collaborators and at a peer level with other health professionals. Again, those sound probably very commonplace now, but at the time it was seen as quite a different approach to nursing education. So this wall is to honor the founding dean, Dorothy M. Smith. This wall was developed and funded and supported by Dr. Linda Aiken, one of our alumni, who's been an outstanding alumnus who you'll probably learn more about as you progress in this course, I hope. And it characterizes and follows a little bit of Dorothy's beginnings as a younger person and as she moved into nursing and then into the College of Nursing. So on this floor, this is the fourth floor of the College of Nursing, just a couple of little add-ons of historical note. The first graduating class that I think I mentioned earlier resides up in this picture here. So it was a small class, and I'm sure you're familiar with the composite pictures that the college has of each graduating class. But you can just see the comparison of this size compared to what your class will be and what the classes in the past few years have been. Also down this hallway, there are a number of framed pictures from, for the most part, from the beginning of the College of Nursing up through the 80s, and then we moved to the large composite. So sometime if you're up on the 4th floor, you get a chance, you can peruse these. So we're here in the history, College of Nursing History alcove on the 3rd floor of the College of Nursing building, and you will see as we move along that there are information panels for each decade, and sometimes in some cases more than one for the decade, that depict selected pieces of the College of Nursing history. My plan today is really to sort of do some highlights of the highlights, if you will, because there's only a certain amount of time to capture some of this information, and hopefully you'll get an opportunity to come back here sometime and really explore a little more depth in the process of it. So the first panel here really just depicts kind of the really early beginning days. The College of Nursing started in 1956. I believe Shands, the building of Shands, as you see in the background of this panel, had started earlier in the 50s, and this just shows the College of Nursing started in what was called the Quonset hut, which these were leftover buildings from World War II. They were all over campus. I think there's still a few left over in IFAS in the agricultural section. So the College of Nursing didn't really have much of a space to begin with, but nonetheless, Dean Smith hired her faculty and got started with the new curriculum of the day for getting students into the program. So moving into the first decade here, starting in 1956 through 1966, as you see, there's a variety of things that happened, obviously, but just some of the highlights really was the beginning of identifying the nursing cap, which was prominent in that day as part of the uniform, identifying the nursing uniform, and also the nursing pin, of which will become meaningful to you towards the end as you graduate, the College of Nursing pin and the pinning ceremony. The first graduation class graduated in 1960 in June. In 1964, the first graduate program was established, and it was Psych Mental Health Nursing. And in 1964, the Sigma Theta Tau Honorary Nursing Society was established in the college. Okay, so welcome to the second decade. Again, as I mentioned, there are more details in each of these panels, so I encourage you to sometime come and peruse each one so you can see a little more breadth and depth of information. The second decade starts with 1967 through 1976. One of the things that's pretty prominent in this decade is what was called the unification model that Dean Smith developed. The unification model, kind of briefly, is a system where there were nurses that were faculty members who also worked in the hospital and had selected roles, and they had a teaching load of clinical students. I myself happened to have one of those positions in the psychiatric mental health unit up in Shands shortly after graduate school in 1972. And the beauty of this role was that faculty got to work with patients, they got to supervise staff, they did hiring and firing. Myself, I taught psychiatric residents family therapy, and then I had undergraduates who were clinical students in psych mental health nursing. So it was a really wonderful combination of tying the hospital and the practice to the educational model. In that same time frame, we had a number of visitors that came from all over the United States and even in South America and other places who were quite interested in this model to visit. And we had some really notable leaders, Virginia Henderson being one of them. If you don't know Virginia Henderson's definition of nursing, I encourage you to look at it. It's probably one of the long-lasting definitions in my view of nursing. And Martha Rogers, who's a theorist, nursing theorist, came, and many, many other people. But it was a very heady time in the college to get this kind of influx of nursing leaders from around the United States to see what Dorothy Smith was up to. And it was really a very invigorating, exciting time. And as a young faculty member, I was just, my head was swirling, I guess I should say. The other probably notable thing that happened during this decade was that Dean Smith then retired. The unification model shifted and changed, partly related to things that were going on at Shands at that time, Shands Teaching Hospital as it was called, in terms of administration, changes and shifts in the College of Medicine and so forth. So those shared joint appointments were diminished, and for example, I became now what was called a full-time faculty member in the College of Nursing. Dean Smith retires, as I said, and was a brief faculty member for a while. And then we had a new dean, the second dean, Blanche Urie was hired, and she came on board in 1973. Dr. Urie was, because of the change in the unification model, Dr. Urie really focused in on kind of innovation and strengthening the undergraduate program. There were quite a few shifts that happened, as I mentioned, because of the nursing faculty who were not in practice anymore. So we're trying to figure out how to manage that kind of deficit of those roles and go in some new directions. So now we're in the third decade, 1977 and 1986, and at the end of 1976, we had the untimely death of Dean Urie. So we then moved into our third dean, Dr. Lois Malasanos. Some of the highlights of this decade, I think, would be the first RN to BSN track was established. We began to bring in nurses that were already registered nurses into the curriculum. And Dean Malasanos focused a lot on graduate education, research, and specialization within the master's level preparation. And then additionally had the leadership for moving us into a PhD in nursing. So that was a significant start. We were the first school in the state to offer the PhD in nursing doctorate. So now we're into the fourth decade, still under Dr. Lois Malasanos' leadership as dean. And the first graduate student received her Doctor of Philosophy in Nursing, which was a really exciting milestone, really, for the college. The Malasanos Research Lectureship was established, and that occurs in the spring in the college, so you all will be in school when the next one occurs. The other thing that happened in this decade was a more solid, really beginning effort with philanthropic efforts. Dean Malasanos established, with the help of the Curbo, the eminent scholarship chair in oncology for the college, and really begin to set a tone for the need for external funding sources and other issues that would support faculty, students, research, and practice. Also in this decade, Dr. Malasanos retired and stepped down, became a faculty member, as often a dean will do for a period of time, and continue to contribute at especially at the graduate level. At this juncture, we then move into our fourth deanship, which is Dr. Kathleen Long, and becomes the fourth dean. Under Dean Long, initially we had many major organizational shifts and changes and curriculum changes and different aspects like that often happens when a new dean comes on board. The other thing that is real notable during this era is the faculty practice plan, which I'll talk about in a little bit, begin to take shape and develop its format. Dr. Linda Aiken, who is a prominent alumni and researcher, and I'm hoping you'll get exposed to some of her writings and research, established a professorship for Dorothy Smith. And there's actually a brick we have in the front of the college. You may have noticed if you look down when you're walking in, selected bricks that honor different individuals, family, alumni, and so forth. And Dr. Linda Aiken has established this professorship as well as the Wall of Honor that I talked about earlier. So now we're into the fifth decade, and this was a pretty exciting time, I think, for the college. It was the 50th anniversary of the College of Nursing, and we had planning eventually for a lot of events and so forth that happened a little bit later towards the the end of 2005 and 6. But also in this decade, the accelerated program, the RN to BSN track began. Dean Smith became Dean Emeritus Smith and also became a living legend in nursing. This is within the American Nurses Association Hall of Fame. It's quite an honor. And I had the privilege of going to that event in Orlando. She was quite a bit older by then, as you can imagine, but it was really an exciting time to see her receive this really prestigious honor. The other thing that happened that's very notable is in 2003, the college got its own building. And that was very exciting. The College of Nursing has lived in many different areas, some that were very formidable, to say the least, as well as tight spaces, et cetera. We started out in the 5th floor of the old Shands, and we lived in the library for a period of time, and then we got moved to the then old library, and then we finally moved into our new building in 2003. It was very thrilling to get into this space, and I still feel like I'm on my honeymoon, really, to be in this building. It's just really lovely. Archer Family Healthcare got established. This is the college's faculty-run managed clinic. Hopefully you're familiar with it or will be in the future. During this period of planning for the 50th anniversary events, then Dean Long and a committee worked on various events that were going to come up for the 50th anniversary in the fall of 2006. And I actually spoke with her about what I considered was the missing history of the College of Nursing. And that's pretty much how this space evolved. So I was really fortunate that she supported the ideas of collecting what we could and developing a format and putting this history alcove together. The other thing that happened was the branding, Care, Lead, Inspire, which I know you're very familiar with already. The history alcove, the branding, and the Dorothy Smith Wall of Honor were all things that kind of grew out of the big celebration that year for the 50th anniversary. So this handsome box represents a time capsule that was put together by myself for the 50th anniversary of the college, and there are a variety of goodies in there, of which only reside with my knowledge base. It's to be opened in 2056, and I'm really mad that I won't still be alive to see the surprises when people open it up. Dean Long, like Dr. Malasanos, also had a strong commitment for philanthropic efforts, and the Marin Foundation was established, and that commits support for nursing education practice, actually fellowships for doctoral students at the Archer Family Healthcare. Another thing that happened in this era was the Ambassador Program, which maybe some of you will consider participating in later, where you will be working with the alumni staff in really supporting efforts and various events that happen in the college. So moving along with more data for the 5th decade, several events obviously. The Doctor of Nursing Practice program was planned during this time frame, and we had quite a process of planning that curriculum, getting established, and again we were the first college in the state to offer the DNP. Additionally, as I mentioned, we created the new logo of the Care, Lead, and Inspire, and we had continuing efforts to include the Nursing Resource Center was dedicated, supported by a former alumni and her family, the Iona M. Pittengale Nursing Resource Center, where you all will spend many, many hours before you graduate. So now we're across the hall from the first area. This is a small area that was developed to get ready for the 60th anniversary of the College of Nursing. And we start with the end of 2006 into 2008. The inaugural symposium for nursing informatics, Rita Cobb, who's a college nursing alumni, was established in this era. Also, the curriculum for the DNP, the Doctor of Nursing Practice, was developed. And in 2009, we had the first DNP class graduated. Also, continuing on, we had Jacksonville campus, which was established about 30 years ago at this point, celebrated its 30th anniversary. Additionally, another event that happened during this era was Dr. Linda Aiken, who I've mentioned a few times before, was listed as one of the 100 most influential people in healthcare in 2010. So it was quite an honor, and again, as I've said earlier, I hope you'll get a chance to read at least one or two of her articles. Moving along, so we're in about 2013 now. This is when Dean Kathleen Long retires, and we then move to our fifth dean, who Dr. Anna McDaniel becomes the college's fifth dean for the College of Nursing. I've now had the privilege of working under all 5 deans, so it's been a really interesting experience to experience different styles, different approaches to the leadership of a college. One of the events that some of you may experience in your clinical placements is the Academic Partnership Unit at Shands, which means the College of Nursing in Shands has a couple of units that are dedicated to educational clinical experiences for students, using faculty as well as staff to help educate students clinically. Another event which will be bestowed upon you in just probably a few weeks was the inaugural white coat ceremony, and this launches our students at the beginning of their professional role in the college, and I believe that comes up for you in September. Under Dean McDaniel's leadership, the other really important things that I think happened in 2014 were the endowed chairs that were filled. We have 3 of those that were filled during that time, and I really encourage you to go to the college website and take a look at that section. So the 3 chairs were filled in 2014, and then in 2015, the 4th chair was filled. So this was quite a good completion of getting these chairs filled, and a lot of effort on Dean McDaniel's part to establish the faculty to support these chairs. I encourage you to really go to the college website and look at the information on these endowments, as well as other scholarships that support students, faculty, and practice for the college. A really notable event was Dr. Linda Aiken endowing a professorship in her name. She also received the Dorothy Smith Legacy Award, and this was at a kickoff dinner for the 60th anniversary of the college. One last thing to note is in the 2016 is that Dean McDaniel was named the Linda Harmon Aiken Professor, Endowed Professorship, which supports excellence in nursing research. And then the college launched its capital campaign along with the university's level campaign with a goal of raising $22 million. So this concludes, as I said in the beginning, kind of a highlight of the highlights of all these different panels. I really urge you to come back and take a look at the particulars. You'll see that there are timelines that align themselves with the college's history as well as nursing's history, as well as some issues that were going on in society. And keep in mind that you are also now a part of this college's history, and we want you to embrace your part in it and participate as you move through the program and become an alumni who really connects with the university and with the college after graduation. Thank you.